Pathology podcast. This episode is Chapter 3, Part 4, Pathologies. In this episode, I'm going to highlight some of the terms for pathologies that tend to be confusing or tend to give people trouble as they're studying and preparing for tests. I'm not going to go over everything in the textbook or everything that you need to know for a test. I'm just hitting the high points of those that tend to give people trouble. The first pair of pathologies I'd like to look at is ankylosis versus arthrosclerosis. And a big question here is what really is the difference between them? Now, I'm going to quiz you. Do you remember what ankylosis means? Well, that's the abnormal stiffening and loss of mobility in a joint. What about arthrosclerosis? Well, that's the hardening of a joint that's usually associated with normal aging. Now, these two terms sound kind of similar, but there's a couple things to look at. First of all is when we talk about ankylosis, our text says loss of mobility. Our textbook tends to use that kind of backhanded expression, loss of something. What they mean is it's not there at all. If ankylosis is going on, there is no mobility in the joint. We would say that there's a loss of mobility to the point that it does not move. We could also say it was fused. And there's a variety of disease processes that can actually cause this to happen. But the thing to remember is it's a fusion of the joint. Now that's different than arthrosclerosis, where it's hardened, it may be stiff, may not move real easily, but it moves. And also, arthrosclerosis is usually attributed to normal aging processes, where with the ankylosis, there's going to be probably an underlying disease of some kind. Okay, and next group of pathologies to look at involves the spine. And the first one is spondylosis. We have talked about that before. Do you remember what spondylosis is? Well, this one we can get pretty easily from the word parts. Spondylosis is any abnormal condition of the spinal column. We've got spondylo, S-P-O-N-D-Y-L/O, which refers to the spine. And then we have our old friend osis, the suffix O-S-I-S. That means any abnormal condition. Now from that, we get to the term ankylosing spondylitis, which is quite a mouthful to say and spell. And do you remember what ankylosing spondylitis is? Well, that is a stiffening of the spine due to an inflammation and fusing of the vertebrae. And if we parse this down, we've got two words, ankylosing and then spondylitis. And ankylosing is modifying spondylitis. So if we look at spondylitis, we've got spondylo, S-P-O-N-D-Y-L/O, combined with the suffix itis, I-T-I-S. Well, spondylo means the spine, itis means inflammation. So we know there is an inflammation of the spine. Well, this inflammation of the spine is severe enough that it is causing ankylosis. So there is a fusing of the vertebrae so that they cannot move. That's ankylosing spondylitis. And we have one more term that's a mouthful that is related to the spine, and that is spondylolisthesis. S-P-O-N-D-Y-L/O, spondylo, which means spine. And then we have a new suffix here, listhesis, listhesis. Listhesis refers to a slipping forward. So what spondylolisthesis means is a slipping forward of one of the lumbar vertebrae on top of the one below it. Okay, now we have another group of terms that do relate to the spine, but also other things as well. The first one is osteoporosis, osteoporosis. This is a fairly common word in the normal vernacular, and the term is normally used correctly. Do you remember or do you know what osteoporosis means? Well, osteoporosis is a loss of bone density and an increase in the porosity of bone that's associated with aging. In some cases, though, people can get osteoporosis, at younger ages rather than older ages. But it generally is associated with aging. Now, we do have one term that refers to those people who are actually quite young and have thinner than average bone density, a thinner bone density than would normally be expected in a person for their age. Do you remember the term for that? Well, that's osteopenia, O-S-T-E-O, penia, P-E-N-I-A. That refers to thinner than average bone density in a young person. It's like pre-osteoporosis. There's some loss of bone, but it's not enough to be full-blown osteoporosis. Well, osteoporosis can cause all sorts of problems in the body. And the first problem that it can cause is something called a compression fracture. And that's spelled like the regular words, compression, C-O-M-P-R-E-S-S-I-O-N, and fracture, F-R-A-C-T-U-R. And a compression fracture is a fracture that occurs when bone is pressed together, and it also is used to refer to the spontaneous collapse of vertebrae due to osteoporosis. Now, sometimes people look at this and they say, oh, the bones are pressing together. That must be a stress fracture. Well, that's not really what this is. When we're talking about a compression fracture, we're talking about a abnormal situation where there's not necessarily a lot of force being involved. It's the weight of the bones on each other causes a collapse. A stress fracture is when someone's doing something pretty severe, like severe athletics, running, maybe trying to kick a wall or something, and then that would cause a bone to break in a foot or leg, something like that. But this is like the bones literally fall apart. They crush each other under their own weight. So there's a pathological thing going on here with the compression fracture. Whereas again, the stress fracture is usually caused by some extreme form of activity. Now, those with osteoporosis can have another kind of fracture known as a Colles fracture, C-O-L-L-E'(S), fracture. And do you remember what a Colles fracture is? Well, a Colles fracture is the fancy word for a broken wrist. And this is an unfortunate thing that can happen to older people. They might take a fall, they reach their arm out to try to break their fall, and because of weakening of the bones, a wrist would just snap. And there's another type of fracture that an older person can have also when they take a fall, and that's known as an osteoporotic hip fracture. osteoporotic, osteoporotic, which would mean pertaining to osteoporosis. There's that IC ending. It's pertaining to osteoporosis, and there is a hip fracture. So it's a hip fracture that happens upon falling, and it happens because of the presence of osteoporosis, a weakening of the hip. Okay, that covers the osteoporosis terminology. And then there's one final group of pathologies I want to look at, and that's related to spinal curvatures. There is a textbook explanation and also a series of drawings that show the spinal curvatures. And in some cases, these drawings could be misinterpreted or they can be confusing to people. And so I want to kind of prevent that or clear that up for you. So let's run through those three curvatures. The first one is kyphosis, Kyphosis. Do you remember kyphosis? Well, kyphosis, also known as a humpback, is when the thoracic vertebra curve backward or outward. They're going posteriorly. That creates a hump in the back. And also, in the drawing, you'll notice that the head of the person is kind of slunched forward, but that's the head. Sometimes people look at what the head is doing and they think, okay, that's hunching forward. No, that what's going on is the thoracic vertebra, the vertebra in the upper part of the back are bowing outward or to the back, which then throws the head forward. So if the vertebrae are curving backward, creating a hump, that is kyphosis. Kyphosis. Okay, the next one is lordosis. Lordosis. Do you remember what that one is? Well, lordosis, also known as swayback, is when the lumbar vertebra, that's the vertebra in the lower back, curve inward or forward anteriorly, which then causes the head or upper body to lean backward. So we've got the vertebrae going forward in lordosis, and it's the lower back, which then kind of pushes the head backward. Again, kyphosis, it's the upper back or the thoracic vertebrae are bowing backward and outward. So if you can just kind of get that in your mind, you can keep these two straight. And then the final one is easier for most people to remember. It's something that is fairly commonly known in the vernacular, and that is scoliosis. Scoliosis. Do you remember what scoliosis is? What is scoliosis? Well, that's the sideways curvature of the spine. And as you may know, this is commonly occurs in adolescents about the time they hit their growth spurt. And usually it's treated with a spinal brace that will brace the back and make the spine grow straight. In extreme cases, surgery might be required where some rods might have to be literally run up the vertebra to force the back into a straight position. Okay, well, now we're going to go back through this with some practice. I'm going to quiz you, okay? Here we go. Number one, what is the term that means an abnormal condition of the spine? Well, that is spondylosis. Spondylosis. Number two, what is the term that refers to the hardening of a joint that's usually associated with aging? That is arthrosclerosis. Arthroschlerosis. Number 3. What is the term for stiffening of the spine due to inflammation of the vertebrae? That is ankylosing spondylitis. Ankylosing is Ankylossing, and then spondylitis is Spondyl, then itis. What is the term for the slipping forward of the vertebrae in the lumbar spine, like one vertebrae would slip over the top of one below it? That is spondylolisthesis. Spondylo, that's the spondylo part, and then listhesis, listhesis. What is the term for the lumbar vertebrae's curving inward, also known as sway back? That is lordosis, Lordosis. And what is the term for a sideways curvature of the spine? Well, that is scoliosis, Scoliosis. What is the term for the thoracic vertebrae curving backwards, also known as humpback? Well, that's our kyphosis, Kyphosis, kyphosis. And what does the term ankylosis mean? Well, ankylosis is stiffening and loss of mobility in a joint so that the bones are actually fused together. There is no mobility. And what is the term for thinner than average bone density in a young person? Well, that's osteopenia. Osteopenia. Thinner than average bone density in a young person. And this is different from osteoporosis. How is osteoporosis different? Well, osteoporosis is the loss of bone density to the point that the bones are actually becoming porous, and it can make fractures more likely. It's also associated with aging. And what is the term for a fracture that's caused by bones pressing together? Well, that's a compression fracture. Okay, by no means is this all of the pathologies that you need to know, but the ones I've gone over again are the ones that tend to be confusing. They tend to be troublemakers. So I hope that this has clarified any confusions that you might have. So this ends this episode of the Medical Terminology Podcast.